everyone, and welcome once again to our YouTube channel. Thank you for your audience, and we really love to have you here. So today we're going to be discussing something that we've been asked frequently in the Wills for Life community group, and that is the use of progesterone only pills. So progesterone only pills, the common and known in the country is microlute, are pills that do not have estrogen and progesterone and therefore are called mini pills. That means it only has one hormone instead of two. That's a good thing because it means that it protects you from the effects of estrogen, among which is breastfeeding. So after getting a baby, we are all very keen on making sure that we can breastfeed the baby, and we know that estrogen reduces the amount of milk that one produces, but progesterone is safe and we call it the hormone of pregnancy. Therefore, you can actually continue breastfeeding and it won't affect your milk supply. So how does it work? It works in a very simple way. It increases the mucus plug at the cervix or down there to make it very hard for sperms to climb up, and that creates a harsh environment for the sperms to actually reach the egg. So because of that thickness, the mucosal lining is also reduced, which is a good thing because implantation and capacitation are reduced. So who can use it? Any woman can actually use this method for a prolonged time between 18 and menopause, around 55 years of age, and there's no restriction that you have to use it in 6 months or 9 months, but it has to be used correctly. People who may not be able to use it, if you have history of breast cancer, history of liver disease, or history of epilepsy, or taking a lot of medication, because some of the medication may actually hinder the uptake of the progesterone or predispose you to something else, which you will discuss with your doctor to see if you're eligible for this particular method. Now, what is the biggest risk when using this method? And this biggest risk is the time factor. It has to be done at the same time. So that means that if you take your medication at 8 p.m. or 8 a.m., you have a window of about 3 hours where in which it would be still safe to use the medication. If you miss a 3-hour window, and depending on the POP that you're using, some 12-hour window, then you've lost the protection that it gives you in that time. And so because of that, we usually recommend that you use another method after the LAM period, which is 6 months of breastfeeding. But if you're correct in your timings, you can keep using microlute and it should still be safe. So what you do if you miss the 3-hour window, take the medication as soon as you remember, and then take the next one the same time the following day. For the next 2 days, still use barrier methods. Barrier methods include a condom or abstinence, just to make sure that you're safe. Other than that, microlute is a safe method. It's a beneficial method. I think the only risk factor for you to remember is that please check to your doctor to know if it's the right method for you, and it may bring bleeding regularities, or rather irregularities. That means for some women, they get their periods as normal but a lighter flow. For some people, they get spotting continuously. For some people, they may go without periods altogether, which is a good thing, I think. So yes, it is safe for you to not have periods during that time. It's because of the effect of the medication and the breastfeeding, especially if you're taking it during breastfeeding. And it doesn't mean that there's something wrong with you, and it doesn't mean that you're contaminated because the blood is not shedding. No, it's okay, and it's part of the medication. But for some women who get irregular bleeding, please check in with your gynecologist to find out how to stop the bleeding or how to regulate the bleeding so that it's good for you. Thank you, and see you in the next video.